And of course, we have our complete team here as well. Major Rico Fernandez.
Hey, everyone.
And Sergeant First Class Michelle Phillips.
Good morning.
Staff Sergeant Scott McMenamy.
Good morning.
And I myself am Sergeant First Class Michael Cube.
Good morning, and thank you again, ma'am, for being with us today. We appreciate your time out of your busy schedule as we can see you in clinic right now. So something that not everybody viewing today is aware of is that Captain Hawthorne happens to be my favorite physical therapist, but that's also because I'm a little biased because she's my youngest sister. So when we start talking about recruiters really like chasing you around, this one knows what it's like because I got her in her undergraduate as an enlisted soldier and I got her again as an Army officer. So you're welcome. So can you kind of start us off this morning, ma'am, and tell us a little bit about your background and, your story?
Sure. So yes, as she said, she recruited me twice. So I was initially an enlisted soldier. I enlisted in 2009 as a preventive med specialist. And then I decided to apply for the Army-Baylor program and got that, which she worked my packet for at the time. So I commissioned in 2015 and I've been an Army physical therapist now for almost 2 years. And I'm currently stationed at Fort Campbell, Kentucky.
So, ma'am, why did you choose the Army?
Well, initially when I decided to join, I was in college still. I enlisted between my junior and senior year, and I wanted to be a doctor at the time, but I didn't want to go directly to med school. I just wanted to take some time off to do something, so that's when I decided to join. And my sister obviously serves, was serving at the time, and my dad served. And I actually talked it over with my dad, and he told me, if you join the military, you'll never regret it. And I never have, so that's kind of what initially kind of led me to do it. Obviously, I did not decide to become a doctor, but I'm a doctor of physical therapy, so kind of close, right? But yeah, that's why I kind of initially decided, and then paths just kind of went different ways than I expected them to, and here I am.
Ma'am, could you take a little bit and tell us about your experience in the Baylor program?
Sure. So I got into the program in 2015, and when you initially get there, you go through Bullock. So you commission upon arrival, you go through the basic officer leadership course for about 3 months, and then we did 18 months of didactic in San Antonio, and then we have a year-long internship, and then graduate, and then take our licensure exam, and then from there, you go to your first duty station.
What's your experience been like as a physical therapist and a provider?
It's been good. I've liked it. So in my internship, it was a lot different just because it was down in San Antonio, which is more medically based as far as, it's kind of our medical campus. So I worked in several different clinics or hospital settings down there. And then I got to have like a good acute care rotation at BAMC, the Brooke Army Medical Center. So it's a lot different. There's a training environment, lots of trainees there. Whereas here, now that I've been at Fort Campbell, it's a force comm unit. So a lot more, combat arms and different types of injuries and just kind of different patient population. And I work exclusively with soldiers here. Whereas there I worked with, retirees, independents, and all sorts of trainees, different stuff. So it's been different, but I've really enjoyed it here at Fort Campbell.
So obviously I have in-depth conversations about what you do on a regular basis, both as your sister and just intrigued as an Army medicine recruiter. Can you explain to our viewers what it's like to be in the brigade element and why that's different than what they would normally deal with?
Yeah, so, since I've been here at Fort Campbell, my first year, I actually spent at an outpatient clinic, and then at the hospital, I did 6 months in each. And then I actually transitioned over to the brigade. So now I work in my own clinic, and it's just me and one tech, whereas in those other clinics, there's several different physical therapists and several techs that can kind of treat your patients. So it's a little bit different in the brigade in that we actually play a role in injury prevention and human performance optimization. So we can go out and audit PRT physical training, and we can do, educational classes and basically just kind of assess the needs of the brigade, try to figure out, what's contributing to injuries and how to, maybe educate soldiers or educate command teams on how to mitigate those injuries. And in a MTF or medical treatment facility, it's more just patient care, mostly, throughout the day, 12 patients a day, seeing, just treating and, assessing and evaluating and reevaluating. Whereas here I get to actually do some stuff outside of my clinic. So it's just kind of a different animal in the brigade.
So, ma'am, how has life as an active Army officer been for you and your family?
It's good. I can honestly say I was enlisted and I was an officer, so I kind of know the difference there. But I was reservist versus now I'm active duty, so it's a little bit of a different comparison. But I enjoy being in the military, and my husband works from home, which is great because wherever we go, we know he'll have a job. So we don't have to worry about, finding a new job at each duty station. And then, our child, we use military childcare when, we're not in the middle of a pandemic, we do. So, he drops, we take turns dropping off, picking up, and it works really well for our family. We really enjoy it.
So, man, with being stationed at Fort Campbell area, what is your favorite thing about being at Fort Campbell?
That's a good question. So I came from San Antonio, which is a huge city, and Clarksville is a little bit smaller, a little bit more rural, and I like that. I like smaller town life. I'm from a town of 300 people, 300, so it's pretty small, whereas Clarksville is definitely not that small. But I just like the smaller town feel of Clarksville. That's probably the biggest thing. We just spend a lot of time outside exercising and, in our neighborhood and stuff. So we enjoy that.
Man, what differentiates Army physical therapy from the civilian counterparts?
I would say there's a couple different things. So military physical therapy in general, I'd say is very orthopedic heavy, in that we see a lot of musculoskeletal injury, achy joints and bones and muscles. Whereas physical therapy in the civilian world, there's different kinds. But for example, we have like acute care, within an inpatient setting in a hospital, or we have neuro PT, recovery after strokes, or dealing with like neurological diseases like Parkinson's disease. We don't necessarily see so much of that. We just deal mostly with kind of overuse injuries or, traumatic type things, that you sustain an injury and then need to recover from. So very orthopedic heavy, but I like that. So it's kind of similar to like a sports med type of thing. So that's one. And then just kind of what we're actually allowed to do as a physical therapist is a little bit different because we don't necessarily fall under state practice act. So we can just do kind of what the military says we can and can't do. So the privileges that we have that are maybe a little different is we can order imaging and labs. We can order, a limited prescription from the formulary. So we don't necessarily have to refer back to our PAs or, to other specialties to do those things. We can coordinate some of that, which kind of expedite, makes the process a little bit faster to get them the care that they need without having to involve a bunch of other people. And then we can directly refer to orthopedics if we think that's necessary, or we talk a little bit more regularly with their primary care doctors, which is nice, which I would say is a little bit different than the civilian setting where you have to kind of ask for permission to do a lot of things. And then just some of the interventions that we can do dry needling, which a lot of state practice acts don't allow. I'm not saying it's the one thing that like makes us super special, but we do have that option, which is just another treatment modality, which is nice to use.
So, ma'am, we're getting to the point where we're wrapping things up, but I believe we have time for one more question. So if you could take a moment and offer any advice to those folks that are applying for the PT Baylor program, what is the one piece of advice that you would want to give them?
I would say the biggest thing that you need to do is kind of look within yourself and figure out your why it is that you want to be an Army physical therapist. I think because it is a little bit different, I think really knowing that going in, because they're going to ask you, is a big piece of it. So whether that's the propensity to serve or just an interest in working with soldiers or whatever it is that motivates you, I would say figure that out and then commit to it. So, show that you have taken the time to engage with military PTs, go try to get observation hours at an actual, MTF or somewhere where you can actually work with PTs and see what they're doing in a military setting, because it is a little bit different. So I would say to show that you've put in that effort is something that they will look at and appreciate, and kind of know that you're not just saying you want to do things, that you've actually done the research and know what you're getting into, and that you're actually committed to it.
Thank you, ma'am, for the great tips. Before we come to a close, I would like to take a minute to give a birthday shout out to my daughter, Elizabeth. Today is her 11th birthday. So happy birthday, Elizabeth.
Happy birthday, Elizabeth.
A couple of shout outs from me. My daughter just had her 16th birthday on the 6th of May. And we celebrated safely at home. And also to my wife, Cherry, and to all the moms in the world, especially, you guys here in the audience, and Cam Hawthorne and Sergeant Phillips, happy Mother's Day. And to all nurses, I salute to all of you, our heroes at the front line. Happy Nurses Week.
Awesome. So thank you again, ma'am, for being with us. We definitely appreciate your time this morning. Next week, we will have with us an Army physician. So this will be the opportunity for any of those HPSP students that are looking for those scholarships for medical school to hear things from a provider's perspective on what to expect with both the scholarship and as an Army physician. So we want to make sure we put that out there. And if anybody has any questions about today or for next week, please comment in the comments below, or follow us on our pages and do the same thing there. But we appreciate all of you for viewing today and being here with us. Please log in every Friday at 10 a.m. here for Sit Call. Have a great day, everyone.
Bye. Happy Mother's Day.